Hey Debbie, I'm going to be doing the Lippincott cardio questions right now. Lippincott, it's actually Lippincott. It starts on page 327 and starting with question 1. A client has chest pain rated at an 8 on a 10-point visual analog scale. The 12-lead EKG reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? Reduce pain and myocardial oxygen demand. 2. A client with chest pain is prescribed IV nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 2. Blood pressure of 88/46. 3. The nurse is caring for a client diagnosed with an anterior MI 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first 1. Assess for changes in vital signs. 4. A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. 6. An older adult has chest pain and shortness of breath. The healthcare provider prescribes nitroglycerin tablets. What should the nurse instruct the client to do? Put the tablet under the tongue until it is absorbed. 7. The nurse has completed an assessment on a client with a decreased cardiac output. Which finding should receive the highest priority? 2. Confusion, urine output 15 mLs over the last 2 hours, and orthopnea. 8. The nurse notices that a client's heart rate decreases from 63 to 50 beats per minute on the monitor. The nurse should first take the client's blood pressure. 9. A client is admitted with an MI and AFib. While auscultating the heart sounds, the nurse notes an irregular heart rate and hears an extra heart sound at the apex after the S2 that remains constant throughout the respiratory cycle. The nurse should document these findings as heart rate irregular with S3. 10. A 60-year-old comes into the ER with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute MI. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, CBC, chest radiograph, a 12-lead EKG, and 2 milligrams of morphine sulfate given IV. The nurse should first 1. Administer the morphine. And I think that really might be a question. 14. A client admitted for MI develops cardiogenic shock. An arterial line is inserted. Which of the following prescriptions from the healthcare provider should the nurse verify before implementing? Metoprolol 5 milligram IV push. 17. The client is admitted to the telemetry unit due to chest pain. The client has polysubstance abuse, and the nurse assesses that the client is anxious and irritable and has moist skin. The nurse should do the following in which order from first to last. The first thing you're going to do is position the electrodes on the chest. The second is take vital signs. Third, you're going to administer the prescribed dose of morphine. And fourth, you're going to obtain a history of which drugs the client has used recently. 19. While caring for a client who has sustained an MI, the nurse notes 8 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to notify the physician promptly. 22. This is the one where you have to mark the spot on the torso. Probably won't be on the test, but you should go back and look at that one. 23. A client has a pulmonary artery catheter insulted. In performing hemodynamic monitoring with the catheter, the nurse will wedge the catheter to gain information about which of the following. 3. Left end diastolic pressure. 26. The nurse is caring for a client who recently experienced an MI and has been started on Plavix. The nurse should develop a teaching plan that includes which of the following points? Select all that apply. 1. The client should report unexpected bleeding or bleeding that lasts a long time. 3. The client may bruise more easily and may experience bleeding gums. 4. Plavix works by preventing platelets from sticking together and forming a clot. 28. A middle-aged adult with a family history of coronary artery disease has the following: total cholesterol 198, LDL 120, HDL 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? 3. The CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications prescribed. 29. The client has been managing angina episodes with nitroglycerin. Which of the following indicate the drug is effective? 1. Decreased chest pain. 31. Alteplase recombinant or tissue plasminogen activator, aka TPA, a thrombolytic enzyme, is administered during the first 6 hours after onset of myocardial infarction to 4. Revascularize the blocked coronary artery. 32. After the administration of TPA, the nurse should 1. Observe the client for chest pain. 33. When monitoring a client who is receiving TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? Cardiac arrhythmias. 35. A client has driven himself to the ER. He is 50 years old, has a history of hypertension, and informs the nurse that his father died from a heart attack at age 60. The client has indigestion. The nurse connects him to an EKG monitor and begins administering oxygen at 2 liters per minute per nasal cannula. The nurse's next action should be to 2. Start an IV infusion. 37. A 68-year-old client on day 2 after hip surgery has no cardiac history but reports having chest heaviness. The first nursing action should be to 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 38. The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 42. The physician refers the client with unstable angina for a cardiac cath. The nurse explains to the client that this procedure is being used in this specific situation to 2. Assess the extent of arterial blockage. 43. The client is scheduled for percutaneous transluminal coronary angioplasty to treat angina. Priority goals for the client immediately after PTCA should include 4. Preventing fluid volume deficit. 49. The nurse is developing a teaching plan for a client who will be starting a prescription of Zocor or Simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following select all that apply. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fat. 52. We are now under the client with heart failure on page 333. 52. A client with a history of heart failure The client has a history of heart failure and has been on Lasix and digoxin and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strip shows first-degree AV block. The nurse should assess the client for signs of which of the following? Dig toxicity. 53. The nurse should assess the client with left-sided heart failure for which of the following? Select all that apply. 1. Dyspnea, 3. Crackles, 5. Oliguria, and 6. Decreased oxygen saturation levels. 54. Which of the following sets of conditions is an indication that a client with a history of left-sided heart failure is developing pulmonary edema? Select all that apply. 4. Coarse crackles. 5. Tachycardia. 55. An older adult with a history of heart failure is admitted to the ER with pulmonary edema. On admission, which of the following should the nurse assess first? 1. Blood pressure. 56. The nurse is assessing a client with chronic heart failure who is demonstrating neurohormonal compensatory mechanisms. Which of the following are expected findings on assessment? Select all that apply. 1. Decreased cardiac output. 2. Increased heart rate. 3. Vasoconstriction in skin, GI tract, and kidneys. And 5. Fluid overload. Okay. 59. The major goal of nursing care for a client with heart failure and pulmonary edema is to 1. Increase cardiac output. 64. The nurse should assess the client for digitoxicity if serum levels indicate that the client has a low potassium level. 66. A client receiving a loop diuretic should be encouraged to eat which of the following foods? 2. Banana. 3. Dried fruit. 4. Orange juice. 70. When teaching a client with heart failure about preventing complications and future hospitalizations, which problems stated by the client as reasons to call the physician would indicate to the nurse that the client has understood the teaching? 1. Becoming increasingly short of breath at rest. 2. Weight gain of 2 pounds or more in one day. And 4. Having to sleep sitting up in a reclining chair. 74. A client is scheduled for a cardiac cath. The nurse should do which of the following pre-procedure tasks? Select all that apply. 2. Check for iodine sensitivity. 3. Verify the written consent has been obtained. And 4. Withhold food and oral fluids before the procedure. 75. Which is the most important initial post-procedure nursing assessment for a client who has had a cardiac cath? 3. Observe the puncture site for swelling and bleeding. 77. A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide to treat pulmonary congestion and begins a nitroprusside drip per physician prescription. The nurse notices a drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess blood pressure. A client who has undergone a mitral valve replacement has persistent bleeding from the sternal incision during the early post-op period. The nurse should do which of the following? Select all that apply. 2. Check post-op CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. And 4. Monitor the mediastinal chest tube drainage. 83. The nurse should teach the client who is receiving warfarin sodium that 3. INR is used to assess effectiveness. Okay, now we are on page 336, and we're doing the client with hypertension. 87. Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with Lasix and Ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 89. A client is taking clonidine or Catapres for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 3. Impotence. And 5. Sleep disturbances. 95. A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at the same time each day. 2. Do not crush or chew the tablets. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. And 6. Report any fainting spells to the healthcare provider. Now 338, the client with dysrhythmias. 105. A client is admitted to the hospital for evaluation of recurrent episodes of ventricular tachycardia as observed on Holter monitoring. The client is scheduled for EPS studies, electrophysiology studies, the following morning. Which statement should the nurse include in the teaching plan for this client? 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. 106. During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals. 2. An irregular rhythm with pulse rate greater than 100. 108. When teaching a client about self-care following placement of a new permanent pacemaker to the left upper chest, the nurse should include which of the following select all that apply. 1. Take and record daily pulse rate. And 5. Avoid lifting anything heavier than 3 pounds. 109. A client has been admitted to the coronary care unit. The nurse observes third-degree heart block at a rate of 35 beats per minute on the client's cardiac monitor. The client has a blood pressure of 90/60. The nurse should take which of the following actions first? Prepare for transcutaneous pacing. 110. A client is scheduled for the insertion of an implanted cardioverter defibrillator. The spouse expresses anxiety about what would happen if the device discharges during physical contact. The nurse should tell the spouse, a warning device sounds before countershock, so there is time to move away. 111. An older adult is admitted to the telemetry unit for placement of a permanent pacemaker because of sinus bradycardia. A priority goal for the client within 24 hours after insertion of a permanent pacemaker is to maintain cardiac conduction stability. 112. The client who had a permanent pacemaker implanted 2 days earlier is being discharged from the hospital. The client understands the discharge plan when the client 3 verbalizes safety precautions needed to prevent pacemaker malfunction. Okay. 113. An 85-year-old client is admitted to the ER at 8 p.m. with syncope, shortness of breath, and reported palpitations. At 8:15, the nurse places the client on the EKG monitor and identifies the following rhythm. See below. The nurse should do which of the following? Select all that apply. So there's 2 pictures. I think she's only going to include the EKG strip. You are going to apply oxygen. 3, monitor vital signs. And 4, have the client sign consent for cardioversion as prescribed. Okay, now we are on 339, the client requiring rapid response of CPR. 114, upon assessment of a third-degree heart block on the monitor, the nurse should first 3. Have transcutaneous pacing ready at the bedside. 116. The nurse is preparing the client for cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 4. Call clear before discharging the electrical current. And 5. Record the delivered energy and the resulting rhythm. 118. A client is given amiodarone in the ER for a dysrhythmia. Which of the following indicates the drug is having the desired effect? The number of premature ventricular contractions is decreasing. 122. During rescue breathing and cardiopulmonary resuscitation, the victim will exhale by normal relaxation of the chest. 123. The rapid response team has been called to manage an unwitnessed cardiac arrest in a client's hospital room. The estimated maximum time a person can be without CPR, without cardiopulmonary function and still not experience permanent brain damage is 4 to 6 minutes. 126. The monitor technician informs the nurse that the client has started having premature ventricular contractions every other beat. Which is the priority nursing action? 2. Assess the client's orientation and vital signs. 128. The nurse is caring for a client whose condition has been deteriorating. The client becomes unresponsive. The blood pressure is 80/40, and the SpO2 is 90% on 50% face mask. The nurse should 2. Call the rapid response team. 1:30. The nursing assistant reports to the nurse that a client is feeling short of breath. The client's blood pressure was 124/78 2 hours ago with a heart rate of 82. The nursing assistant reports that the blood pressure is now 84/44 with a heart rate of 54, and the client stated, "I just don't feel good." Which of the following interventions should the nurse initiate? 1. Confirm the client's vital signs and complete a quick assessment. 2. Inform the charge nurse of the change in condition and initiate the hospital's rapid emergency response team. 4. Position the client in a semi-Fowler's position. 5. Stay with the client and reassure the client. And 6. Call the physician and report the situation using SBAR. So that is it for Lippincott cardio questions. And the next one I will do will be Mosby's. Hope it helps.